Over 65? 3 worst pain pills you should never take, and 3 joint-safe fixes you must try. Aging brings many beautiful things, wisdom earned through experience, cherished memories, and a perspective on life that only time can offer. But let's be real, it also brings some not-so-welcome guests like aching joints, stiff backs, and sore knees that just won't quit. For millions of people over 65, these nagging pains become a daily struggle. And in the search for relief, it's all too common to reach for the medicine cabinet, hoping a quick pill will make everything better. But here's the problem. Some of those trusted pain relievers may actually be doing more harm than good. What starts as temporary relief can slowly snowball into bigger problems, especially as we age. From hidden liver damage to a greater risk of heart attack or kidney failure, many of the most popular pain medications come with serious side effects that aren't always discussed openly. And the older we get, the more vulnerable our bodies become to these dangers, even at normal doses. So if you've been taking something for joint pain every day, thinking it's safe because it's over-the-counter or doctor-approved, it might be time for a second look. The truth is, not all painkillers are created equal, and what worked in your 40s or 50s might be quietly wreaking havoc in your 60s, 70s, or beyond. The good news? There are joint-friendly, body-safe alternatives that can provide real relief without putting your heart, liver, or brain at risk. Today, we're breaking down 3 pain pills seniors should think twice about and sharing 3 smarter, natural options that work with your body, not against it. But before we dive in, I'd love to know, how old are you and where are you watching from? Drop it in the comments. It's always inspiring to see just how many people are taking control of their health. 1. Ibuprofen, Advil, Motrin, the everyday relief that could be quietly harming your heart and kidneys. For many people, ibuprofen has been a trusted companion for decades. Whether it was for a sore back after gardening, a tension headache, or the occasional flare-up of arthritis, this over-the-counter painkiller likely found a place in your medicine cabinet early on, and stayed there. It's easy to see why. Ibuprofen works fast, it's affordable, and it doesn't require a prescription. But here's the harsh truth that many people over 65 aren't told. What once seemed harmless could now be putting your health at serious risk. Ibuprofen belongs to a class of drugs known as NSAIDs, non-steroidal anti-inflammatory drugs. They reduce pain and inflammation by blocking certain chemical signals in the body. That might sound helpful, and in some cases it can be. But the way these drugs work can also disrupt critical processes in your heart, kidneys, and blood vessels, especially as your body changes with age. After 65, your organs don't process drugs the same way they did in your younger years. Your kidneys become more sensitive. Your heart and blood pressure may already be under added strain. And unfortunately, ibuprofen can quietly make all of that worse. Regular use has been strongly linked to elevated blood pressure, even in people who've never had heart issues before. It also reduces kidney function, sometimes subtly, sometimes severely, which can snowball into chronic kidney disease or even kidney failure over time. Perhaps most alarming, studies have connected ibuprofen use in seniors to a significantly increased risk of heart attack and stroke, especially in those already taking medications for high blood pressure or heart disease, which, let's be honest, includes many adults over 65. And here's the kicker. While ibuprofen might seem like it's helping, it often just masks the pain, giving you the illusion of healing while the underlying inflammation and joint damage continue to progress. So you feel better for a few hours, but the cost may be silent and long-lasting damage to your vital organs. If you've been using ibuprofen regularly and you're over 65, it might be time to rethink your pain strategy. There are safer, more sustainable ways to reduce inflammation, ease joint pain, and protect your overall health. without putting your heart and kidneys on the line. If you're ready to ditch risky medications and discover natural joint-safe solutions that actually work, don't forget to subscribe and tap the bell icon too. Naproxen Aleve. Tough on pain, harsher on your stomach, and liver naproxen is another NSAID that many seniors trust, often without realizing the long-term dangers. Its reputation as a gentler NSAID is misleading. While it might offer longer-lasting relief than ibuprofen, naproxen carries a high risk of gastrointestinal bleeding, especially in older adults. Over time, naproxen can erode the stomach lining, leading to ulcers or internal bleeding, increase bleeding risk when combined with blood thinners, aspirin, or heart medications, cause liver strain, particularly in those over 65, whose liver function may already be declining. In fact, the FDA and American Geriatric Society warn against long-term naproxen use in seniors because of these very risks. And if you're already taking medications for blood pressure, cholesterol, or diabetes, the combination with naproxen can become even more dangerous. So while the pain relief may be tempting, the long-term trade-offs, bleeding, liver damage, and gut complications simply aren't worth it. 3. Acetaminophen, Tylenol, a hidden risk to your liver, mood, and mind for decades. Acetaminophen, more widely recognized by its brand name Tylenol, has been considered the go-to over-the-counter pain relief option for seniors. It's often promoted as a gentler alternative to NSAIDs like ibuprofen and naproxen, primarily because it doesn't irritate the stomach lining or thin the blood. Doctors frequently recommend it for older adults, assuming it's the safer choice for managing chronic pain, arthritis, or even minor aches. But here's the truth that's not often discussed. Acetaminophen carries its own set of serious and often silent dangers, especially for people over 65. The biggest concern lies in how acetaminophen affects the liver. It is metabolized through the liver in a way that creates a toxic byproduct, and the margin between a safe dose and a dangerous one is shockingly narrow. In fact, acetaminophen is the leading cause of acute liver failure in the US. Even slightly exceeding the maximum daily dosage, which is only 3,000 to 4,000 mg per day for healthy adults, can tip the scales toward liver damage, particularly when combined with alcohol, other medications, or pre-existing liver conditions. What makes this even more dangerous is that acetaminophen is hidden in hundreds of products, including cold and flu medications, sleep aids, and all-in-one pain relief formulas. Many seniors unintentionally double dose without even knowing it. But liver toxicity isn't the only concern. Newer research is raising red flags about acetaminophen's effect on the brain. Long-term use has been associated with slower cognitive processing, memory impairment, and even emotional blunting, a condition where people feel emotionally flat or disconnected. Some studies suggest it may also contribute to mood swings, depression, and reduced empathy. That's particularly troubling for seniors already navigating the cognitive shifts that can come with aging. Imagine taking something daily that's quietly diminishing your mental clarity and emotional well-being. Furthermore, older adults are often more sensitive to drug interactions, and acetaminophen can amplify the effects of certain prescription medications, especially those for high blood pressure, cholesterol, or anxiety, without clear warning signs. And if you happen to enjoy a glass of wine now and then, the combination of alcohol and acetaminophen can quietly wreak havoc on your liver, even if your drinking is moderate. In short, while acetaminophen may seem like the safe option because it's easy to find and doesn't cause immediate discomfort, its long-term use poses serious risks that become more dangerous as we age. If you rely on Tylenol or any other medication containing acetaminophen for daily pain relief, it's worth having a conversation with your doctor about safer alternatives. Natural anti-inflammatory solutions, lifestyle adjustments, or physical therapies may offer pain relief without the cognitive fog, mood imbalance, or organ stress this silent chemical can cause over time. Now that we've seen the risks, what can you do instead? Thankfully, there are powerful natural solutions that don't just mask the pain. They target the root causes like inflammation, stiffness, and joint wear. Let's explore 3 safe, science-backed alternatives that support joint health without the risky side effects. 1. Curcumin from turmeric, nature's inflammation fighter that rivals pain pills without the risks. When it comes to natural joint support and pain relief, few remedies have attracted as much scientific interest and global praise as curcumin, the golden yellow active compound found in turmeric. For centuries, turmeric has been a cornerstone of traditional Indian and Asian medicine, not just as a flavorful spice, but as a healing agent used to combat everything from digestive troubles to skin wounds. But it's only in the last few decades that modern research has caught up with ancient wisdom, revealing that curcumin may be one of the most powerful natural anti-inflammatories known to science. Why does this matter for people over 65 dealing with chronic joint pain, arthritis, or general inflammation? Because inflammation is at the root of nearly every form of joint degeneration, whether it's osteoarthritis, rheumatoid arthritis, or even general wear and tear from decades of use. What makes curcumin so extraordinary is its ability to fight inflammation at the cellular level, targeting inflammatory pathways in the body, much like pharmaceutical NSAIDs do, but without the dangerous side effects that those drugs often bring, such as gastrointestinal bleeding, kidney damage, or cardiovascular risks. In fact, multiple human clinical trials have shown that curcumin can be just as effective as ibuprofen in reducing joint pain and improving mobility in people with arthritis. One prominent study even found that patients taking curcumin experience similar, and sometimes better, pain relief compared to those on prescription NSAIDs, but without reporting any of the stomach upset or adverse reactions. That's a big deal for older adults who may already be juggling a complex mix of medications and age-related health conditions. 2. Omega-3 fatty acids, nature's joint lubricant and inflammation. Tamer from the inside out. When you think about joint health, you probably picture stretching, physical therapy, or maybe topical creams. But what many people over 65 don't realize is that true joint comfort starts from within, at the cellular level. That's where omega-3 fatty acids come in. These essential fats, found abundantly in fatty fish like salmon, sardines, and mackerel, as well as in plant-based sources like flaxseed, chia seeds, and walnuts, are among the most powerful nutrients you can consume for reducing chronic inflammation, easing joint pain, and improving overall mobility. As we age, it becomes more difficult for the body to maintain optimal levels of omega-3s, especially in modern diets that are often heavy in processed foods and low in fresh seafood. This imbalance can tip the scale toward excess omega-6 fatty acids, which are known to promote inflammation. Over time, this contributes to stiff, painful joints, increased arthritis flare-ups, and even accelerated cartilage breakdown. That's why getting enough omega-3s is not just helpful, it's critical for those in their golden years. Clinical studies have consistently shown that omega-3s, especially the types known as EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, can dramatically reduce joint pain, morning stiffness, and the overall need for pain medications in people with osteoarthritis and rheumatoid arthritis. They work by lowering the body's production of inflammatory chemicals such as prostaglandins and cytokines, which are often responsible for that deep, aching pain that many seniors wake up with. 3. Boswellia, Indian frankincense, an ancient remedy revived by modern science. If you're over 65 and dealing with daily joint pain, stiffness, or limited mobility, chances are you've tried over-the-counter pain relievers and maybe even felt some relief. But as effective as NSAIDs, non-steroidal anti-inflammatory drugs, can be, they often come with an unfortunate trade-off. Long-term use can lead to digestive upset, ulcers, kidney strain and increased cardiovascular risks. That's where Boswellia serrata, also known as Indian frankincense, offers a promising and time-tested alternative. Used for centuries in Ayurvedic medicine, Boswellia is now making waves in modern science circles as a natural inflammation balancer, with none of the harsh side effects linked to conventional pain medications. What makes Boswellia so effective and unique is the way it modulates inflammation without completely shutting down the body's natural healing response. Unlike NSAIDs, which often block inflammation broadly, sometimes to the body's detriment, Boswellia works intelligently. It specifically inhibits the 5-lipoxygenase, 5-LOX enzyme, which is responsible for producing pro-inflammatory molecules called leukotrienes. These molecules play a key role in the chronic inflammation associated with arthritis and joint degeneration, and taming them can bring about significant pain relief, improved mobility, and better overall joint function. Multiple clinical studies have shown that regular supplementation with Boswellia can lead to meaningful improvements in joint flexibility, reduced stiffness, and lower pain scores, often in as little as 1 to 4 weeks. In patients with osteoarthritis of the knee, for example, Boswellia has been shown to significantly improve walking distance, joint comfort, and overall quality of life. It even supports connective tissue regeneration, helping to protect cartilage and slow down further joint deterioration. Pain relief shouldn't come at the cost of your long-term health, yet for so many people over 65, that's exactly what happens. It's easy to reach for familiar over-the-counter pain pills, especially when the aches become part of daily life. But what many don't realize is that these quick fixes can quietly cause lasting harm, from elevated blood pressure and kidney stress to liver damage and even memory issues. These aren't just minor side effects, they're serious consequences that can steal your quality of life. But here's the good news: you're not stuck. You don't have to choose between living with pain or risking your health to numb it. Nature offers powerful, time-tested solutions that are far gentler on the body, yet highly effective. Natural compounds like curcumin from turmeric, omega-3 fatty acids from fish or flax, and Boswellia, an ancient anti-inflammatory herb, have been shown to support joint comfort, reduce inflammation, and improve mobility, without the harsh side effects of conventional painkillers. So tell us in the comments, which of these 3 risky pain pills shocked you the most? And which of the natural fixes are you excited to explore for your own wellness journey? Don't forget to like, subscribe, and share this video with a loved one who might be unknowingly putting their health at risk. There is a better way, a smarter, safer path to pain relief. Love your joints. Give them what they really need. Support your body's natural healing instead of just silencing the symptoms. And most importantly, stay informed, stay empowered, and stay moving. Thanks so much for watching, and always remember, eat like a person, not like a patient.